Or someone you know has dealt with jaw or back pain, even migraines. New tonight, a way to relieve pain without surgery. And people who've used it say those common problems went away because of a miracle therapy.
I was in an elevator fall at work.
Two people.
I was grinding my teeth.
Two different problems. One solution. It's called craniosacral therapy. Virginia Johnson uses this gentle, hands-on treatment for all kinds of ailments, like Libby Johnson's chronic back pain.
And you can tell when the pain starts to dissipate. And it's such a relief that it helps you relax even further.
Elizabeth, we have this new little retainer that you're going to...
Elizabeth Dickerson's TMJ caused horrible headaches.
Oh, it's made a huge difference. It's a huge difference. And it's not some new age type of medicine. It really is hands-on, and when you get immediate relief from it, there's no denying it.
Elizabeth's dentist referred her to a craniosacral therapist.
I have about 85% of my patients don't need cranial therapy, but about 15% do. Now, of the 85% that don't need it, 50% of them would still benefit from it, but it may be more of a luxury than a necessity.
It can help relieve a lot of different symptoms because it's so central and so core to the body.
I can come in and when I leave, I feel like $1 million. I just feel so much better.
Now, both Libby and Elizabeth go to therapists about once every week to a week and a half. Virginia charges $65 an hour at Living Well Therapeutics, but I found a child whose therapy is covered partially by insurance.
5, 6, 7.
Cody Clem looks like every other fifth grader who loves to dance. He has no problem keeping the beat on stage. But Cody struggles with other things in life. He's autistic.
He still has his good days and his bad days. But I think he has more good days now than bad.
She credits this.
Can you put your head back so I can work on it this?
Craniosacral therapy. People who perform the technique, like Brenda Horn, who's also a physical therapist, use a light touch and say it relieves pressure on the brain and spinal cord,
so that the body can work more effectively. And sometimes it works really quick. I mean, I've seen results just amazingly quick. And others, it takes much longer.
For Cody, his mom says it took about a month for people like his school teacher to notice something was different.
She just stopped me one day at school and she said, you know, Cody's been interacting more with the other kids and was going around the room asking them questions and talking to him, and she was just really surprised, and obviously she didn't know.
That's not all. Vicky says her son now sleeps in his own room and through the night, even when his biggest fear rolls in.
He used to be very fearful of thunder and lightning, to the point that if he saw gray clouds in the sky, he started getting upset before there was even any noise. Now, I think the last storm we had, I went in and checked on him in the middle of the night, and he was fine.
You know, if you can go from functioning at 50% to functioning at 60%, you're better, you know, and if you can go from 60 to 70, every little bit helps you be more functional in society and in your life.
Cody may never be 100%.
Sometimes it makes me feel better.
But his loved ones see improvement, and that makes all the difference, whether he's here or his favorite place, performing. Now, Cody sees Brenda about once every 2 to 3 weeks, usually for about an hour at a time. Brenda works on physicians' referrals. She charges $140 an hour at the Chickasha Physical Therapy Clinic, but again, sometimes insurance will cover part of it. And you'll find more information about this therapy in the Ask Him 5 section of KOCO.com.